We don't have permission to play a video in this, so nothing could possibly go wrong. So we are Healthcare Wayfinder, and this is the fabulous team. The problem that we set out to solve is Dewi. So this is Dewi, a data scientist. He's a recent computer science graduate, and he's got a pretty limited knowledge of the NHS and biology. He's been a user. He's been a user of the NHS, but a fairly light one. But today is his first day working as an NHS data scientist. Yay! And the question is, what we're setting out to solve is how can he get up to speed? So why are we doing this? The NHS needs people with data skills, like Dewi, but we can't expect them to come to us knowing how health works. So we want to get them up to speed quickly or help them find their way. So we're building a learning resource that Dewi and his manager can use in his first couple of weeks to find his way quickly around health and the healthcare system. We thought a lot about how we wanted to do this. On the screen, you can't see one of those, but on the screen we thought a lot about kind of some of the aspects of how we would do that, how we want it to be. One of the key values is that we want it to be empowering for people, and we don't want it to be just kind of passively delivering a lot of resources, delivering a lot of information. It's really about encouraging Dewi in his first couple of weeks to start thinking about how his organisation works, get out, start talking to people, start talking to, for example, clinical colleagues, start those conversations, and explore existing resources in other places. So this is where we go. I'm handing over to Callum for a demo.
Let's just go to the main slides.
Oh, we can maybe.
Cool.
Yeah,
so
let's just go. Yeah.
Let's just run through it as a live demo on the platform. Then, if I can work out how to use this touchpad. Cool. So what we've tried to do is build out a set of themes that govern kind of the content that you might want a day one data scientist in the NHS to look at. So, for example, looking at humans in healthcare, we've got a kind of series of explorations you can have, and I'm still struggling with using this trackpad. For example, something about healthcare ethics, and coming from a computer science context when you're not necessarily particularly experienced in that, you can go through and you can have a look at why this matters. There's some key questions. We want you to try and actively learn by using those resources to solve those questions. At the end, there's some kind of more targeted activities for you to try and use out. We've also made some of our own content throughout the day as well. So there's obviously what we built, but for example, we've also featured some videos recorded during the event, this one featuring Marie. So, going back to that, we've also just tried to make it a nice user-friendly experience by incorporating an AI assistant that's able to provide summaries of the content within that. We haven't got that running because it's running locally. And we've also got some value-added content about how you use the platform, what is the intention behind it, and again, a nice little video taking you through that story about what's the point, why is this learning style useful in order to kind of really embed that knowledge and go beyond just reading a load of documents in your first week on the job.
And so just to wrap up, I'm struggling with the trackpad too. So we're really keen for you to try it out. There's the link to the website. You can also see our GitHub repo, and importantly in that, one of the things is a roadmap for future development, where we think this might go next, some of the features. If you've got ideas for it to extend it, we'd love to collaborate.
We can see you. Well done. Any questions?
So, two questions. Firstly, Dewi, do you feel ready for day 2? Having access to this wonderful resource?
Yeah, so it was to get you on board and then also as a resource that you can come back to. I think the great thing was we tried to focus on stuff that's not going to go out of date. So it's like getting me to ask the right questions and connect with the right people. So if it goes somewhere new.
And then do you see it as something that would integrate with the wider training programme? So, for example, the manager would be able to assigned tasks on it, and formal training could be linked through to it as well.
Yeah, so on our roadmap, we've got ambitions to have kind of a personalised pathway that you come through. Not all of these modules are going to be relevant to everyone, and some people might have that knowledge already. So what we need to do is kind of give that opportunity to have that discussion, identify where your skill gaps are, create that personalised learning pathway, and then look at things like, you know, recording your own voices and maybe using some of kind of the AI assistant tools to help do things like help critique some of your work and kind of extend your thinking further and, you know, give you that active learning kind of, again, going both ways, not just reading things.
So as part of the project, we looked at the existing landscape, and there's lots of resources for data scientists, so we didn't cover things like how do I use R and stuff like that. So the idea is that we're filling a gap, which is the what the hell is the NHS, how the hell does it work gap.
You can actually answer that question, you've won, right?
Okay, any other questions?
Can you engage with the Parliamentary Health and Social Care Ombudsman? Because this would be amazing in a complaints context, I reckon.
Yeah.
Great
Really
recommendation. Thank you.
Who thinks that you would use this to try and understand the NHS?
That's not bad.
You should have done that. Well done. Thank you very much.